The human body is the most accurate biography that exists. It doesn't need words. It speaks in scars, postures, and silencers. I am Dr. Carlos Alvarez Peña, neurosurgeon, and in this presentation, I will try to reconstruct the story of Sylvester Stallone, Rocky, based on public information released by him over the years, scrupulously respecting the ethical handling of that information. This is not about judging, but about understanding from the perspective of science and medicine how it is possible for a human being to transform trauma, physical pain, and loss into strength and perseverance. In the documentary Sly, released by Netflix in 2023, Stallone reflects, "My body has been my script, every blow a sentence written upon it." For more than 5 decades, his body has been his language, and his mind has been shaped by the need for control and self-improvement. His scriptwriter. Why did Stallone become a writer out of necessity? Written language replaced spoken language when facial paralysis made oral expression difficult. Neuroplasticity found its way, turning a deficit into creativity. Now, let's talk about his cervical surgeries. During the filming of The Expendables in 2009, Stallone suffered a cervical fracture that required anterior fixation with a metal plate and screws. In the documentary Sly, radiological images are shown that also confirm a previous lumbar surgery, visible in real images of Stallone himself. These procedures reflect the physical toll of a career built on enduring physical impact. Cervical fusion, that is, joining 2 vertebrae together, decreases intervertebral mobility, while lumbar fusion, on the other hand, reduces the flexibility of the lumbar spine, altering the distribution of all physical loads on it. What is the result? Chronic cervical spinal cord damage, myelopathy. In other words, the spinal cord stops functioning normally and causes stiffness in the movements of the spine, which is noticeable even when you see him walking or standing during a ceremony. Stallone himself says, "I'm full of metal, but I'm still standing." And he really is. Every screw, every plate is another sentence written on his body. And what is the price of excess that he's had to pay? I don't have any record of shoulder surgeries, but clinical observational evidence shows that Stallone suffers from chronic rotator cuff tendinopathy in his left arm, which is even documented in interviews and can be seen in his movies after 2006. The excessive use of his muscles, the imbalance between strength and flexibility, in filming fight scenes without stunt doubles explain these injuries. In physiological and medical terms, the constant microinflammation of the supraspinatus and infraspinatus tendons, as well as other muscles, leads to progressive fibrosis, joint stiffness, and loss of range of motion in the joint. These chronic injuries, while not disabling, contribute to the limited and compensatory movement pattern of his upper limbs, which we can see in any video of Stallone. The face that defined him, congenital facial paralysis, and his brain's adaptation. Stallone was born after a traumatic delivery assisted with forceps, which caused an injury to the left facial nerve. The damage affected the mandibular branch of the 7th cranial nerve, resulting in a permanent partial peripheral paralysis. In the documentary Sly, he explains it himself. "They pulled me out with forceps, they cut a nerve, and that's why I talk like this." From a neurological point of view, this type of injury, occurring in the neonatal stage, causes early cortical reorganization in our brain. The hemisphere opposite to the injury strengthens the orofacial motor areas, creating a functional compensatory adaptation. Neuroplasticity allowed him to develop partial muscle control and a unique vocal identity. Socially, that difference marked him from childhood. The teasing he endured as a child activated his emotional limbic system and shaped a temperament based on overexertion, control, and self-improvement. His face, a result of this paralysis, became a trademark and the universal symbol of perseverance. Let's now talk about muscle as an endocrine organ that protects the brain and memory. At 78 years old, Stallone maintains an extraordinary muscle mass. This trait isn't just aesthetic, it's neuroprotective. Muscle is an endocrine organ that produces hormones. During contraction, muscle releases myokines, which are hormones that stimulate neurogenesis, synapses, and memory. These substances travel from the muscle to the brain, where they promote hippocampal plasticity, which is where the substrate for memory and neuronal resilience against aging resides. Additionally, endogenous testosterone, which comes from strength training, helps maintain cognitive function. Testosterone modulates the density of certain neuronal receptors, including its influence on attention, orientation, and spatial memory. In other words, his muscle mass has acted as a hormonal protective barrier against brain deterioration caused by aging. While many men progressively lose their muscles after 50, Stallone has maintained his, directly and significantly prolonging his mental sharpness. He says, "Training isn't vanity, it's survival." Published in Men's Health magazine in 2011. And from a biological standpoint, he's absolutely right. But life is life, and Stallone had to face the loss of his son, Sage Stallone. On July 13, 2012, Stallone's son was found dead at his home in Los Angeles at the age of 36. The coroner's report determined severe coronary atherosclerosis as the main cause of his death. Sage Stallone was an actor, director, and producer, and he played Rocky Balboa's son in Rocky V in 1990. During this filming, Stallone wrote one of the most famous scenes of his career, the dialogue between father and son, where without any barriers, fiction and real life ended up blending together. It's not about how hard you hit, but about how hard you can get hit and keep moving forward. Behind that iconic phrase, repeated millions of times around the world, lies a biographical truth. Stallone was speaking from his own life experience, marked by physical pain, humiliation, and perseverance. Years later, when Sage Stallone died, that phrase took on a new meaning in his memory. The man who described it had to apply it literally, to be hit by the hardest loss and keep moving forward. After his son's death, his body language changed. In interviews and in the documentary Sly, you can see a reduction in his facial expressiveness and a more introspective look. From the perspective of affective neuroscience, this corresponds to a process of reconfiguring his limbic neural networks involved in the response to grief, particularly the amygdala, the anterior cingulate, and the insula. All of these are in the brain. In other words, Stallone's brain reorganized his pain into functional silence. His drive to compete gave way to a need to understand what was happening in his life. He no longer talked about triumph, but about endurance. That same reflection is captured in a later quote of his during the Sly documentary itself. "I've spent my whole life trying to prove that I could get back up, even when no one else believed I could do it." From a medical and human perspective, Stallone is a case of unique progressive neurobiological resilience, a mind that turned loss into structure and trauma into purpose. The biology of his atypical aging is remarkable. At 78 years old, Stallone represents a unique medical phenomenon, a highly muscular body with a partially rigid neurological architecture. His cervical and lumbar surgeries, both confirmed in the documentary Sly that I've been referencing, stabilized his structure but reduced his overall flexibility. However, his cognitive and emotional capacity remains intact, thanks to the constant stimulation of his nervous system through exercise. Muscle, discipline, and neuroplasticity form a triangle of biological compensation. In Stallone, the documentary, willpower and biology have come to an agreement. Move less, but keep creating. So, what's the conclusion? Sylvester Stallone is an exemplary case of physiological and cognitive resilience. His body, altered by trauma, surgery, and time, has become an adaptive machine that embodies 3 medical lessons. First, trauma can lead to functional reorganization. Second, muscle protects the mind. Third, discipline is a neuroprotective factor. At his age, 78, Stallone no longer symbolizes strength that dominates, but strength that endures. His medical and personal story is a reminder that the body can be vulnerable, but also infinitely adaptable. Thank you for joining me in this analysis of the life, anatomy, and function of Sylvester Stallone, Rocky, a man who transformed pain into structure, discipline into biology, and loss into language. I am Dr. Carlos Alvarez Peña, neurosurgeon. And on this channel, we explore how science reveals the limits and adaptations of the human body. Subscribe to join me in upcoming episodes, where we will analyze other characters and explain their strengths through the lens of medicine. Thank you.